started to participate because we wanted to see what the outlook was with the diabetes management. We perceived that we were doing a pretty good job with diabetic management, but we also haven't had the opportunity to benchmark against others. We've typically benchmarked against our own data. So this was going to give us an opportunity to see where we stood in comparison to others. So I think the most significant piece that we came onto as we were going through the process was the ability to implement and utilize our health maintenance features on our EMR. It's been a work in progress with the EMR, and we had not fully enabled all the features. We realized early on in the registry that we weren't demonstrating our flu shot compliance and pneumonia shot compliance with our patient population. So we actually put together a comprehensive team from the hospital side and the practice side to make sure that we were accurately capturing those flu shots at every point of entry into our system, including those that show up in the practice having received that immunization somewhere else. So that's been kind of a neat foray into the registry and into EMR to understand and value that piece of the tracking mechanism that the electronic registry gives you. The only other thing I think is interesting is that often our providers have been a challenge because they love their paper records and they're so comfortable with them. So moving to electronic has been, as it is for everybody, change is difficult. But the patient safety features in there, I think, are probably some of the most powerful things that an EMR and ultimately PCMH bring to you as we move forward. And that is, for example, the allergy interactions, the drug interactions. In the past, when you'd write a prescription, you somewhat relied on the team to catch anything that might be contraindicated. And now there's so many great features that pop up right away that allow you to have a better look at every medication that patient's on from every point of entry into the system. And as a hospital-based practice, that's a pretty significant accomplishment for a community.